Demonstrating a repair of the meniscal tear in the knee using surgical implants with sutures. A meniscal tear occurs in the meniscus, which is located in the knee, between the femur or the thigh bone and tibia or shin bone. The meniscus helps to cushion the joint and keeps it stable. First, the surgeon prepares to insert a surgical device through the meniscal tear, which is the crescent-shaped fibrocartilage injury in the knee. Here, the laser lines on the tip of the device measures the desired depth to place the implant in the meniscus. Next, the tip of the surgical device is pushed through the meniscus to place the first implant with suture. The implant is shaped like an oblong button and is responsible for securing the suture in place. Next, the surgeon inserts the second implant with suture the same way. The second implant is connected to the first implant by suture. A knot is created at the first implant and the sutures are tightened, closing the meniscus tear and repairing it. The suture is cut, completing the repair.